Introduce yourself and give us a couple quick thoughts.
Never answer questions like that from the floor, from my advice. What do you want me to do here?
I want you to give a couple quick observations on what you heard.
I heard build a business case. I heard who's going to pay for social change, not the charitable sector, not government. Business will. However, I have a concern. My understanding of the corporate world is that everything becomes a commodity. And my concern with individuals is that we need a commons. We need a place that's free to go to. Where do we pull that into this discussion? Is that good enough? I don't know what else here.
But what else struck you?
What else really struck me? Who's going to pay? Oh, and I already said that one. Who values the outcome we're producing? What would happen if we go away? And that is a question that I think is really important for all nonprofits to ask, all funders to ask. What happens if we're not on the picture? Not necessarily all of us all together, because I don't think that would happen. But what happens if we as individual organizations go away? What happens if we as individual people go away? Where is the impact that we are making? And that's a question to continually ask, and it's a reflective question.
Thank you.
Yeah.
Thank you. That was very bold and courageous. I'll give a quick response, and then I'd love your thoughts or comments. I don't think we should just rely on corporations. I think that's one small part. I think we should realize that there are a lot of different types of people who value our outcomes. There's government impact buyers. There are social investors who are looking for certain outcomes. There are beneficiaries who can pay. I mean, look at the YMCAs of Calgary. They cost $61 a month for membership at the downtown Y. That's more than Gold's Gym across the street. But they're also subsidizing anybody who can't afford to go there too. More than 50% of their budget is covered by membership fees because people value what they're doing. So it's not all about corporate, it's about how to figure out a different kind of business model. And it's not just earned income, but it's who values what we're doing. What do you guys think? Yes?
In full disclosure, for the sake of full disclosure, my name is Andrea McManus, and I'm a fundraising consultant in Calgary, and I'm also chair of the International Board of the Association of Fundraising Professionals, which produces the Advancing Philanthropy magazine that you mentioned.
All right, bring it on.
Okay.
And you would probably appreciate.
Trying to decide whether to say.
You would probably appreciate my latest book, which is called The End of Fundraising.
I don't appreciate that book actually.
But it's not really the end.
I've actually heard you speak a couple of times, and
Yeah.
you did speak at an AFP webinar, which I participated in, and I do agree with almost all of what you're saying. I do agree that we need to look at things in new ways. I do agree that there is huge untapped potential out there, and I was particularly struck by your comment that the solution of social problems, I may not have this exactly right, is the last great untapped market. I find that particularly inspiring. On the other hand, I do have to take issue with how you relegate philanthropy and fundraising in your overall theory. You said most donations are leftover money, and most volunteering is leftover time. And I couldn't disagree more with that statement. I'm willing to bet that 100% of the people in this room are both donors and volunteers, and that makes us philanthropists. And that the work that, not only the work that we do, but the resources that we provide on a volunteer basis or from our own financial resources are not leftover money or leftover time. They are acts of philanthropy that do make change. And I agree that they certainly do not individually solve the big problems that you're talking about, but they do make it possible to get closer to those big problems. In Canada, corporate giving is somewhere between 10 and 13%. We don't have great statistics in this country, but somewhere between 10 and 13% of total charitable giving, which is in the range of $10 to $12 billion. The rest, most of that, the vast majority of that comes from individuals. Now that tells me, in agreement with you, that there's huge potential, but it also tells me that there's huge potential side by side for philanthropy. Mm-hmm. And when you talked about, the hand gestures, that kind of fundraising, just as an FYI, is probably more on the 3 to 4 cents on the dollar, not the 20 cents on the dollar.
I agree.
So I think, I agree with what you're saying, but I take great exception to the way you characterize fundraising and philanthropy and giving.
Yeah, well,
That's just
fair enough. Thank you for your comment. I appreciate that. And understand this, what I'm trying to say is that the value proposition that we offer people for volunteering and donations is emotional. And I don't know anybody who volunteers and risks getting fired from work because they didn't finish their job for the day. I don't know anyone who donates money before they put food on their own table. So my point is simply that the amount of money we're going after and the amount of time we're going after is a sliver, and I think that's a beginning. I'm not saying it's something we shouldn't do. I think it's a foothold, but I think if we can dimensionalize that and say, how do we provide greater value to you in your volunteering? How do we provide greater value to you in your giving? And allow you, again, look at the example of Free the Children, where they're not just, people aren't just volunteering, they're buying an experience. They're teaching their kids about the value of philanthropy and giving back and making a difference. I just saw a show, in a morning show about a kid in Calgary that went on one of the trips. So it's not about stopping those things. It's just about realizing that we just have the beginning toehold of that value proposition, and how do we maximize that? I fundamentally agree, and I certainly don't mean to diminish it. All I'm trying to say is we need to step it up and figure out how to maximize that value proposition that we're making to people. Other thoughts or comments?
Jason,
Yes.
I'd just like to thank you for shifting the conversation. I left yesterday feeling that the dynamic was powerless, and you've shifted it to powerful. Your picture of leverage, I think I left yesterday thinking that most people in the room felt like the rock might crush them rather than being able to push it. So thank you for again asserting that we have most of that power that we need. And thank you for the audacious proposition. We have audacious people in the world like Diamandis and Kotler who are setting forward with abundance mentality to eliminate poverty in the world by 2035. It's only by realizing that we aren't in this alone, and that we have a real value, that we can actually begin to solve these problems rather than band-aiding them. As long as we continue to manage social issues will manage to continue. So it's in those solutions that I thank you for your message today.
Thank you. And one, thank you very much for that. And one follow-on point to that and to the preceding comment is that even for philanthropy, which is absolutely vital to our existence, again, don't get me wrong, we need to start somewhere, but we can show more value in terms of the outcomes that those funders are looking for, rather than just justifying our programs. We can talk about outcomes and results, and talk about and produce better value for their dollars. So I don't know a philanthropist or a donor that doesn't question how much value they're getting for their donation, and I think this applies there as well, that we need to raise the value proposition to those folks as well. The next comment, yes.
I have another question for you and a comment. First of all, my comment is I really appreciated your examples, although in Canada our hospitals are government funded, just so you know. They don't have money.
You guys always remind me, I know.
Fair enough. I have two questions. One of them is a lot of the organizations that I tend to work with tend to be small, rural organizations, several board members. They may or may not have a staff member. In order to get them to shift that mentality, it would need to make them go from being that small organization to being the Free the Children, which I understand happened in that case, but I'm not sure that the energy is always there around what that looks like. So my question is about smaller organizations is one piece, and the other piece is if you have an example of a value proposition from a capacity building type organization, say maybe CCVO or something like it.
Yeah, two very good points. So first of all, I think there's three ways to innovate for nonprofits. One is to increase scale, right? So you can say we're going to go from helping these number of people to helping a huge population. But that's only one way. The other way is to be able to expand scope. So we're not just going to provide coats to homeless people, we're going to help eradicate homelessness. We're not just going to help people with English for second language, we're going to help people become work-ready immigrants. And so it doesn't have to take a huge scale, but another way to think about this is how do we expand the focus of our outcomes to produce a higher value outcome that people can invest in more. And sometimes that requires partnerships. And frankly, I think it's not surprisingly difficult for small nonprofit organizations to survive. I started one, it was $300,000 a year, or started off at $150,000 a year. And it was an intermediary organization as well. So I'll speak to that in a minute. But my point is, it's not all about getting big. It's about solving a problem that we can find value for. And it can be in a small, in rural markets, locally sourced food is really important to restaurants these days, and providing farmers a more sustainable way to live. There are certain banking regulations that require banks to reinvest in communities, and they need facilitated ways to do that. That's another way that we can invest in rural wealth creation. We can create and train employees, even if it's a small number. But for example, in Africa, Cummins Engines, one of the biggest diesel engine makers in North America, has a big market in Africa. And there's no one to maintain their engines because there are no diesel engine mechanics. So here's a small charity training out of work, unemployed people to become diesel engine mechanics and solving a problem in the market. So I think we can use ingenuity and innovation through three ways. One, expand scale. Two, expand scope. And three, leverage the market to find pain points that we can solve. And certainly as an intermediary, I think it's absolutely essential. Again, I think we need to look at our value proposition. There are two different value propositions to most intermediaries, and certainly CCVO. There's a downstream and an upstream value proposition. The downstream value proposition is to all of the nonprofit organizations that are members who value learning, new ideas, technical capacity building, access to resources. I think for them, and many of you in the audience, and I would ask, if I'm going to be bold enough, but I would ask you, we won't do it right now, we'll do it afterward, on a scale of 1 to 10, how much value are you getting from CCVO first? And then second, you are our customers. How do we double that value proposition to you? What would make you pay twice the amount of membership dues that you're paying today? What's your pain? How can we help you? And innovate our programs to produce that greater value downstream. The second thing, and it's not CCVO alone, but it's all of the donor forum intermediaries and Imagine Canada and all of these organizations are hugely valuable. But we can find out how to be more valuable. And we can also find out how to be more valuable upstream, talking to funders and corporate partners, asking them the same question. How do we add value to you? How do we make your job better? How do we solve pain? I don't want to be a vitamin. I want to be a painkiller. So how can we double our value proposition to the funding community, to the government, to the corporate, and to the foundations, and ask them? And you know what? I guarantee you they'll tell us. And then we can double the value proposition, and people will gladly pay if we're helping them to solve problems that are really valuable. So I think you are so well positioned, and you have a market that is thriving and valuable, and you are needed. There's always a way that we can improve our value, though, and I think that's the course I would suggest.
We're going to take one more very, very quick question and answer that Dale's been waiting patiently. Thank you. This may be a question, I was thinking of it more for the panel later, but I'll ask it now and ask maybe other panelists to think about it. But I also would be interested in an observation. Some of you may have heard this morning on the news that Burger King announced today that they're going to be putting their suppliers on notice that within 5 years they want to purchase eggs and pork from animals that were not raised in cages. So I've been thinking, coming into then to this presentation, who's my Burger King? I don't know if animal welfare interests are very strongly represented here, but it's an example of that social, that the economic value of what we would also see as a social good. So I just wondered if you had observations on, for those of us in human services, particularly, I think there are folks here maybe in arts and sports as well, how we go about finding those pieces. I don't know if anyone was behind that or if they just came up with it on their own. Maybe they solved their own pain.
Yeah, that's a great question. I think we need to find the market for cannibals who want cage-free people. I'm just kidding. I'm just kidding. I think, first of all, it's a great example of the market valuing social change. And Burger King did not do that out of the goodness of their heart. Full disclosure, we advise McDonald's and Walmart and many big companies, Disney and others, on how to develop this social value proposition. McDonald's is realizing, they a year ago made a similar commitment, but they're realizing that consumers want to feel good about their experience, and that's going to change their behavior in the store. So they're doing this because there's an economic value to the social change that people want. I think for human services, it's the same thing. We need to identify what changes are we making in society that are creating benefits or could create benefits upstream. And most of what human services is about helping people to become economically stable and help them to be integrated into the workforce. Sometimes there's mental health and other health-related issues. But I think if we marry up our social agenda, which is helping people to become economically stable and productive in the workforce, with what the impact buyers want, and we do our market research to find out, okay, Encana, okay, Synovus, okay, TransCanada, okay, TELUS, what pain are you having? What workforce needs do you have that we can help solve? We can start to aim our social intentions, and it doesn't matter what workforce we're developing as long as it's helping them plug into the economy. So I think we could start to do some research and benefit there as well. Look, at the end of the day, I'll give you the same advice Napoleon gave to his troops as the enemy was advancing, and they were gathered around, and they didn't really know what to do, and so they said, General, what's the battle plan? The enemy is advancing, and we don't know how to attack. And he paused, and he looked at them, and he said, Il faut s'engager et on verra. Engage, and the possibilities will emerge. Thanks.